Did you know that the medication keeping your kidneys functioning might ironically harm them? Discover now the surprising side effects and what you can do to avoid them. Like and subscribe to our channel. Each like and subscription helps us bring you more quality health content. Your participation makes the difference. Kidney medications play a crucial role in treating various medical conditions that affect the kidneys. Among the most common types are diuretics, which help the body eliminate excess fluids and are often prescribed to treat hypertension and heart failure. Another important group includes angiotensin-converting enzyme, AC, inhibitors and angiotensin II receptor blockers, ARBs, which are used to lower blood pressure and slow the progression of chronic kidney disease. Additionally, medications like phosphate binders are used to control phosphorus levels in patients with advanced kidney disease, preventing serious bone complications. Furthermore, there are erythropoietic agents, which are vital for patients with anemia due to chronic kidney disease, as they stimulate the production of red blood cells. Each type of kidney medication is specifically targeted to address different aspects of kidney function and requires careful monitoring to optimize benefits and minimize associated risks. It is essential for patients receiving kidney treatments to be under regular medical supervision to adjust dosages, monitor treatment efficacy, and identify possible side effects early, thus ensuring the safety and effectiveness of the treatment. Many kidney medications, especially diuretics, are known to increase the risk of dehydration in patients. Diuretics like furosemide and hydrochlorothiazide work by increasing the amount of water and salt expelled by the kidneys, which helps reduce blood pressure and fluid volume in the body. While essential for controlling conditions like congestive heart failure and hypertension, these medications can lead to excessive fluid loss, resulting in dehydration. This is particularly dangerous for the elderly or those with pre-existing health conditions who may not feel thirst adequately or have difficulty maintaining proper hydration balance. To prevent dehydration while undergoing treatment with kidney medications, it is vital for patients to maintain a regular fluid intake, adjusted according to medical guidelines. Healthcare professionals generally recommend monitoring the color and amount of urine, which are useful indicators of hydration status. Additionally, it is important for patients to have their kidney function and electrolyte levels regularly monitored, allowing timely adjustments in medication to avoid complications. Educating patients about the importance of maintaining proper hydration and recognizing signs of dehydration, such as dizziness, dry mouth, and extreme fatigue, is crucial for effective management of these medications. Kidney medications, particularly ACE inhibitors and ARBs, significantly impact blood pressure regulation. These medications are designed to lower blood pressure by reducing vascular resistance, thereby facilitating blood flow. However, while they help manage conditions like hypertension and chronic kidney disease, they can also lead to a sudden drop in blood pressure, known as hypotension. This can be particularly problematic for patients taking high doses or combining these medications with other antihypertensive treatments, increasing the risk of dizziness, fainting, and even serious accidents from sudden falls. Conversely, some kidney medications, such as steroids and certain immunosuppressants used in treating autoimmune kidney diseases, can cause an increase in blood pressure. These effects can occur due to fluid retention and increased vascular resistance, leading to cardiovascular complications if not adequately controlled. It is essential for patients undergoing treatment with these medications to have their blood pressure regularly monitored. Dosage adjustments or the addition of antihypertensive medications may be necessary to keep blood pressure within a safe range. Continuous monitoring is crucial to avoid extreme pressure fluctuations that could compromise cardiovascular health. Kidney medications, especially diuretics, can significantly impact electrolyte levels in the body, commonly affecting substances like potassium, sodium, and magnesium. Loop diuretics, such as furosemide, increase water excretion by the kidneys, but can also lead to the loss of potassium and magnesium, which are essential for muscle and nerve functions. Conversely, potassium-sparing diuretics like spironolactone reduce potassium excretion, potentially causing hyperkalemia, a dangerous condition characterized by excessively high potassium levels in the blood. Both conditions require careful monitoring, as significant imbalances can result in severe cardiac issues, muscle weakness, and other health complications. Additionally, improper sodium management is another common concern in patients using kidney medications. Diuretics often increase sodium elimination, which can be beneficial for patients with hypertension, but can also lead to hyponatremia, a condition where blood sodium levels become dangerously low. Symptoms of hyponatremia include confusion, seizures, and extreme fatigue, significantly affecting the patient's quality of life. Therefore, it is crucial for healthcare professionals to guide their patients on the importance of maintaining a balanced diet and regularly monitoring their electrolyte levels to prevent complications arising from these imbalances. Many kidney medications can cause gastrointestinal problems as side effects, with the most common being nausea, vomiting, and diarrhea. These symptoms can be particularly prevalent in medications like ACE inhibitors and ARBs, which, although effective in lowering blood pressure and protecting kidney function, can disrupt the gastrointestinal system. Nausea and vomiting, for instance, often occur when the body tries to adjust to the medication during the initial weeks of treatment. In more severe cases, these effects can lead to dehydration and electrolyte imbalances, worsening the patient's condition rather than improving it. Faced with these challenges, it is essential for doctors to advise their patients on how to minimize gastrointestinal impacts. This may include taking medications with food to reduce gastric irritation or adjusting doses until the body becomes accustomed. Additionally, in cases of persistent diarrhea, underlying causes may need to be investigated or medication substitution considered. Continuous monitoring and open communication between doctor and patient are crucial to quickly identify adverse effects and take necessary measures to ensure both the treatment's effectiveness and the patient's well-being. Interestingly, while kidney medications are prescribed to protect and improve kidney function, in some cases, they can end up harming the kidneys, a phenomenon known as nephrotoxicity. This usually occurs with medications that, despite their benefits, have the potential to damage kidney tissues when administered in high doses or over a prolonged period. Antibiotics like gentamicin and non-steroidal anti-inflammatory drugs, NSAIDs, often used to treat various conditions, can reduce blood flow to the kidneys or cause direct damage to kidney cells. This toxicity can result in a reduced ability of the kidneys to filter waste from the blood, potentially leading to acute kidney failure. To mitigate these risks, it is crucial for the use of such medications to be carefully monitored by healthcare professionals. Patients with pre-existing kidney failure or other kidney problems are particularly vulnerable and require special attention, including dosage adjustments and, in some cases, the selection of alternative therapies with lower nephrotoxic risk. Additionally, regular kidney function tests can help detect any signs of deterioration before they become severe. With this preventive approach, it is possible to balance treatment efficacy with renal safety, minimizing the risk of long-term kidney damage for the patient. The interaction between kidney medications and other types of medications can lead to significant complications, increasing the risk of adverse side effects or decreasing treatment effectiveness. For example, diuretics, when used concurrently with non-steroidal anti-inflammatory drugs, NSAIDs, can reduce the effectiveness of diuretics and increase the risk of kidney damage. Additionally, kidney medications like ACE inhibitors can interact with potassium supplements or potassium-sparing diuretics, increasing the risk of hyperkalemia, a potentially fatal condition characterized by elevated potassium levels in the blood. These interactions can be complex and vary depending on the patient's medical condition, medication dosage, and the presence of other health conditions. It is essential, therefore, for healthcare professionals to conduct a thorough review of all medications and supplements the patient is taking before prescribing kidney treatments. Careful monitoring after starting a new medication is also crucial to detect any signs of harmful interactions early. Dosage adjustments or even medication substitution may be necessary to ensure patient safety and treatment effectiveness. With this proactive approach, doctors and patients can work together to minimize the risk of drug interactions and promote effective kidney health management. The prolonged use of certain kidney medications can lead to cumulative damage to kidney tissue, a significant concern for patients undergoing long-term treatments. Medications like non-steroidal anti-inflammatory drugs, NSAIDs, and some antibiotics have been associated with an increased risk of chronic interstitial nephritis, an inflammatory condition that can progressively deteriorate kidney function. Additionally, Medications like calcineurin inhibitors, used to prevent rejection in kidney transplants, can cause vasoconstriction of blood vessels in the kidneys, reducing renal filtration efficiency and leading to long-term kidney damage. The persistence of these effects can result in chronic kidney failure, requiring more intensive treatments like dialysis or kidney transplantation. Therefore, it is vital for patients on long-term kidney medication regimens to be regularly monitored through kidney function tests. This monitoring helps detect early signs of kidney function deterioration, enabling timely adjustments in medication or therapeutic approach to minimize further damage. Additionally, educating patients about the signs and symptoms of kidney problems can facilitate early detection and appropriate treatment. Adopting a proactive and vigilant approach is essential to protect kidney health and maintain patients' quality of life over time. Tumor lysis syndrome, TLS, is a serious and potentially fatal medical complication that can occur after treatment of renal cancers and other types of cancer, especially those that respond quickly to chemotherapy or radiotherapy. This syndrome occurs when cancer cells disintegrate too rapidly, releasing a large amount of substances into the bloodstream faster than the body can process through the kidneys. The breakdown products of the cells, including uric acid, potassium, and phosphorus, can accumulate in the blood, leading to dangerous conditions such as hyperkalemia, hyperphosphatemia, and hypocalcemia, eventually causing acute renal failure, cardiac arrhythmias, and seizures. Prevention and management of TLS require a careful and proactive approach. Doctors typically identify high-risk patients for TLS based on the type and stage of cancer, as well as the tumor burden before starting treatment. For these patients, strategies such as adequate hydration, use of medications that reduce uric acid levels, and intensive monitoring of electrolyte levels and kidney function are implemented before and during treatment. This rigorous monitoring is crucial to detect the early signs of TLS and intervene promptly with treatments that can stabilize electrolyte levels and maintain kidney function, thus minimizing the risks of severe complications or death. Renal medications, like any other class of drugs, have the potential to trigger allergic or hypersensitivity reactions in some patients. These reactions can range from mild to severe and include symptoms such as rashes, hives, itching, and in more severe cases, angioedema and anaphylaxis, which are medical emergencies requiring immediate treatment. Allergic reactions are generally an immune system response to a substance it considers foreign, even if the drug is generally deemed safe for most people. Specific medications, such as ACE inhibitors, are notorious for causing angioedema, particularly in certain ethnic groups. It is crucial for patients to inform their doctors of any prior history of allergic reactions to medications before starting new renal treatment. In case allergic reactions occur, it is important to immediately stop using the medication and seek medical assistance. To manage and prevent severe reactions, healthcare professionals may prescribe alternative medications and recommend carrying emergency medications, such as epinephrine autoinjectors, for patients with a history of anaphylactic reactions. Careful monitoring during the first doses of any new medication is also a common practice to ensure patient safety and allow for quick intervention in case of an adverse reaction. Fatigue is a common side effect of many renal medications, significantly impacting patients' quality of life. Medications such as ACE inhibitors, angiotensin receptor blockers, and some diuretics can cause these symptoms due to their effects on the cardiovascular system and electrolyte levels, which can affect the body's energy and overall well-being. Fatigue can be particularly debilitating as it reduces the ability to perform daily activities and can affect the patient's motivation and emotional state, contributing to a constant feeling of tiredness and lack of energy even after adequate rest periods. It is important for healthcare professionals to recognize the impact of fatigue when prescribing and managing renal medications. Informing patients about the possibility of experiencing fatigue can help them adjust their routines and expectations regarding their health condition. Additionally, medication adjustments may be necessary if the fatigue becomes overly burdensome, or complementary strategies such as dietary adjustments, increased hydration, and moderate physical exercise may be recommended to help mitigate fatigue and improve quality of life. Continuous collaboration between patient and healthcare provider is essential to find the right balance between treatment efficacy and quality of life. Patients with pre-existing medical conditions face additional risks when prescribed renal medications due to the complexity of their health conditions and the potential interactions between different treatments. For example, patients with diabetes or cardiovascular diseases may experience additional complications when using diuretics, which can affect blood glucose control and blood pressure. Similarly, medications like ACE inhibitors and angiotensin receptor blockers, while beneficial for kidney protection, can increase the risk of hyperkalemia in patients with compromised kidney function. The complexity of these interactions requires careful assessment and detailed therapeutic planning to avoid exacerbations of existing conditions. To mitigate these risks, an individualized approach to medication management in patients with multiple health conditions is essential. This includes a comprehensive review of the patient's current medication regimen, frequent dosage adjustments, and continuous monitoring of side effects and underlying health conditions. Additionally, educating the patient about the signs and symptoms to monitor can enable early detection of emerging problems, facilitating prompt interventions and necessary adjustments. This heightened level of care is crucial to ensure patient safety and maximize the efficacy of prescribed treatments, considering their complex medical conditions. In the search for treatments with fewer side effects, many patients and healthcare professionals turn to natural alternatives and complementary therapies. These options include medicinal herbs, supplements, and dietary changes, which can help support kidney function and are generally perceived as gentler on the body. For example, using herbs such as horsetail and dandelion, which have natural diuretic properties, can aid in fluid elimination without the severe side effects of pharmaceutical diuretics. Additionally, curcumin, found in turmeric, has shown potential in reducing inflammation and protecting against kidney damage in some preliminary studies. However, it is crucial that such alternatives be discussed and monitored by healthcare professionals, as their efficacy and safety can vary, and some may interact with conventional medications. Patients interested in exploring alternative treatments should always inform their doctors about any herbs or supplements they are considering and seek advice from specialists in integrative medicine or naturopathy. Additionally, lifestyle changes, such as increasing physical activity and adjusting dietary intake of proteins and salt, are also valuable strategies that complement medical treatment and contribute to renal and overall health, with the added benefit of improving physical and mental well-being. When considering the use of renal medications, it is essential to carefully weigh the associated benefits and risks. These medications play a crucial role in treating various renal and cardiovascular conditions, helping to manage symptoms, prevent complications, and improve patients' quality of life. However, as discussed, they also come with potential side effects that can range from mild to severe, including changes in blood pressure, electrolyte imbalances, gastrointestinal issues, and even renal toxicity. Awareness and understanding of these effects are crucial so that patients and healthcare professionals can make informed decisions about treatments. Therefore, continuous monitoring of side effects is an indispensable part of managing any renal medication regimen. Patients should be encouraged to report any symptoms or concerns to their doctor, allowing for timely adjustments to minimize risks and maximize benefits. Additionally, considering less aggressive alternatives and lifestyle changes can offer additional support and potentially reduce dependence on medications. Ultimately, collaboration between patient and healthcare provider is key to effective renal therapy management, ensuring a balanced approach that prioritizes both treatment safety and efficacy. So, did you already know about these side effects of kidney medications? Knowing how to keep your kidneys healthy is crucial, and now you're armed with information that can make a difference. Be sure to comment below on which information surprised you the most, and if there are any questions we can clarify in the next video. Remember, your feedback is essential for us to continue bringing content that makes a difference in your health and well-being. Activate the notification bell so you don't miss our updates. Stay tuned, because in the next video, we will explore more medical secrets that few people know about. See you then. See.